a patient is diagnosed with cancer, it doesn't just affect the patient, right? It's a disease of the entire family, right? The parents are now focused on the child who's sick, who's taking care of the siblings. The parents are out of work. They're busy taking the child to the hospital. They have a lot of worries, a lot of anxiety, and they don't get a reprieve. So when you take the child and the sibling and you put them in a camp environment, not only are you helping the patient, but you're helping the siblings and the family, because the parents get a reprieve, and not even a reprieve, they get a child who's re-energized to come back and to fight again.
Welcome to the Sunrise Magic Makers podcast. I'm Melissa Curley, and I will be sitting down every episode to talk to the incredible individuals who have helped bring the magic of sunrise to children with cancer and their families over the past 20 summers. Today, I am joined by Dr. Carolyn Fein Levy, who talks to us about her personal journey with cancer, as well as the incredible impact of sunrise that she has witnessed on her own patients and their families. Hi, Dr. Fein Levy.
Hi, Melissa. How are you today?
I'm great. Thank you so much for joining us.
My pleasure.
Really excited to have you on the podcast. You've been a part of the sunrise story for many, many years at this point. And we're just really excited to talk to you about a lot of really interesting things that we're, working on and thinking about when it comes to our kids right now. So I would love to just give you a chance to introduce yourself to our listeners and tell them a little bit about who you are, what you do, and, how long you've been involved with Sunrise.
Okay. Well, first of all, thank you so much for the opportunity. I think I've been involved with Camp Sunrise since 2006, so that might be the beginning.
Yes, it was.
But that's not the beginning of my story, so I'm going to take you back a little bit further. I was born in Brooklyn. I was the youngest of three kids. And in 1979, I was diagnosed with an ovarian tumor, a malignant ovarian tumor. And I sort of trace everything back to when I was diagnosed, and almost everything in my life is as a result of my experience. So when we talk about pediatric cancer survivors, we talk about late effects of therapy and how they impact on your life. And so for me, we can summarize this whole conversation very quickly that the late effects are that, thank God I am a cancer survivor. I am a pediatric oncologist as a result of being a cancer survivor. And thankfully, I am a mother of three and a grandmother of six. That sort of just summarizes everything in short.
Yeah.
But in the detailed version, I'm currently the head of pediatric oncology solid tumors at Cohen Children's Medical Center in New York, part of Northwell Health. I've been here since 2008. I trained at Mount Sinai Medical School and for medical school and residency in New York, and I did my fellowship at Memorial Sloan Kettering. And when I went into pediatric oncology, my goal was to work with children, work with families, and to give back a little bit of what I had received as a child to help other people get through their cancer experience and to be able to survive and thrive after their life with cancer.
Wow, that's a really powerful story. And you're doing incredible work, and we're really, really lucky to have you as part of the Sunrise team as well. So you have a very unique outlook on Sunrise because you have had the opportunity to see the same kids in your exam room that are spending the summers at camp with us. And I would love to talk to you about what it's been like to see both sides of it.
So I think the most important aspect of camp is camp lets kids be kids again. So we really rob them of their childhood. We take them out of school. We take them out of their normal environment. We take them away from their peers. And even if they go back to school, they're not in an environment with peers who understand what they're going through, or for people who just get it. The biggest problem, I think, for patients going through therapy or patients who are done with therapy is everyone kind of feels bad for them. Like, oh, I'm so sorry you're going through that. I'm so sorry you're going through that. But what they need is people to understand. They're looking for empathy rather than sympathy. So Camp Sunrise is a place where they could be kids again. They could go and they can play, and they don't have to explain why they're bald. They don't have to explain why they have scars. And they can, because the people around them are all the same, and they just get it. And to be in an environment where everyone around you is just accepting of who you are, but also available if you need it. So the kids think they're coming to camp, but really they're coming for physical therapy because they're running around and doing things. They're coming to learn fine motor skills because they're doing arts and crafts. I was definitely very good at beading when I was in camp that summer. They learn how to do social interactions, right? Remember, if you're in the hospital, the only people you're talking to are doctors and nurses. You're not really talking to your friends anymore. So learning how to relate to peers is something that some of the children lose. And then the thing that they lose the most is being with their siblings, because particularly after COVID, we don't really have sibling visitation in the hospital, right? We limit the number of people at the bedside, the number of people in the room, and young children can't be there. And Camp Sunrise offers them an opportunity to be kids and an opportunity to be siblings. And so it's a very, very special, unique environment. There are other cancer camps, but there are none that allow siblings. And so when a patient is diagnosed with cancer, it doesn't just affect the patient, right? It's a disease of the entire family, right? The parents are now focused on the child who's sick, who's taking care of the siblings. The parents are out of work. They're not able to, they're busy taking the child to the hospital. They have a lot of worries, a lot of anxiety, and they don't get a reprieve. So when you take the child and the sibling and you put them in a camp environment, not only are you helping the patient, but you're helping the siblings and the family, because the parents get a reprieve, and not even a reprieve, they get a child who's re-energized to come back and to fight again. We have a hard time getting our patients in for early morning appointments, except for in the summer. In the summer, kids are running in. I got to get the bus. Can I come early tomorrow? And I'm like, you don't come before 11 or 12. And they're like, no, I need to get the bus to get to camp. So it just changes their whole outlook. They're not patients, they're campers.
Yeah, absolutely. I love that you've had the opportunity to kind of see that difference in them when they're going through the summer at camp. One of the things that we are really talking about right now at Sunrise and diving into, which you touched upon, is this idea of childhood being essential. The things that we learn in childhood and the pieces of us that we really build in childhood, but then to go a step further, when a child is dealing with cancer, there are things that are happening in their body and their brain when they're laughing and playing and connecting with their peers. And I was hoping to talk to you about that from more of like a medical, physiological standpoint.
So I'm going to take it back to my mother. So when I was sick, there were no camps. There were no organizations that came by and visited patients in the hospital. There were no Sunrise Sundays to give you energy throughout the year. There was really just my mother. And my mother was truly an incredible force of nature. She had a very positive attitude. Everything was about seeing the good in what we could what we were getting through. Like we used to, it was in the days of Pac-Man, it was a long time ago. So I used to visualize, the bad cells being eaten up by the good cells. We would, work on the power of positive thinking. And she believed every person who interacted us was a messenger to help us get through the situation. And she really believed that laughter was the best medicine. And she kept me laughing throughout the whole thing. So she was my sunrise, so to speak, in the process. And I think that as physicians, we know that they need something else, but unfortunately, we can't provide that, right? I have to get the patient in, get them their chemo, get them to the next treatment, get them to the surgery, prepare them for everything. So we don't have those tools in our armamentarium to help them re-energize for their experience. And so patients are sluggish, they're tired, they're not feeling well, and they don't feel like kids anymore. But when they go to camp, they can do arts and crafts, they can go swimming, they could hang out with their friends, they can socialize, they can go on a bus, right? They're so isolated. And all of those things, we always believed that they were helpful and we always knew that they were important. But then there was this recent impact study that Sunrise worked on, and it really shows a tremendous impact on these children. Like, it's not surprising to me, and it's probably not surprising to those of you who work in camp, but it's really nice to have scientific data that shows what an impact camp has. And the most fascinating part is it's not just the camper, but it's the family and the siblings. And so building resiliency and building powerful children who become young adults who take this experience with them, what we want is for them to have well-being, right? Everything nowadays is about wellness. And so what is wellness? Wellness is, in my opinion, taking your experience, whatever it is, and processing it and reframing it to make it positive, right? So if I tell you having had cancer was the most pivotal, impactful experience of my entire life, and I am who I am today as a result of that, it's because I, with the help of my mother and those around me, like my doctor, who was amazing, who was larger than life, helped reframe the experience as a positive experience. So not everybody has family members or has the support system to do that. But by taking them to camp and putting them into real life situations and real interactions with their peers, it helps them learn and develop, and it helps them laugh, and it helps them smile, and it helps them want something. Like, the kids get so excited when they're here and the Sunrise on Wheels is here and they're doing activities and coloring, and you're talking to the parents nonstop, and the kid's like, can I just go back to the waiting room because I just want to go hang out with the Sunrise people? Or they're like, if you're going to keep talking, like, I don't really need to listen, can I go back out? So they feel it when they're here, they feel it in camp, and it carries them through the entire treatment. And I think it carries them through their lives. And I think part of that is, maybe I'm jumping ahead, but one of the things we see is a lot of our patients who are your campers go on to become your counselors. And they go on to become either physicians or child life specialists or people who are involved in some way. Some patients have no interest in being doctors, but they go on in some way to be givers, right? So when you're sick, you're a taker. You're forced to relinquish all control of your life. If you're an adolescent trying to develop independence, you are completely dependent on your parents, right? And there's such a struggle, but enabling them to go to camp and be independent and to be with teenagers and do regular teenage stuff is such a gift that it really helps them live again and move forward and re-energize.
Yeah, absolutely. One of the other things that we've also been talking about when we talk about like this further impact is the fact that so many of these children, when they're in the hospitals, when they're in isolation and they're missing out on, quote unquote, normative childhood experiences that teach us things. Like, we learn so much as children through the way that we play and the way that we interact. And I would imagine that when these kids are not given those opportunities, there are life skills that are missed.
Right. I think there's a social skills aspect that's missing. And, I remember going back to school. I was sick when I was in 6th grade, and I basically didn't go to 6th grade. My mother made it that we went once a month to school to visit the school, so I had some social interaction. But when I went back, and I think we were in the locker room changing, and the girls were talking about their hair, which wasn't such an issue for me. And they were talking about really normal 6th, 7th grade things to talk about. And I was like, really? That's important? And it took me a really long time to reacclimate to the environment and to learn how to talk like a kid again. I was like, well, my alpha-fetoprotein is this, and I'm having surgery here, and and they're like, we don't want to talk about that, right? So there's two aspects. One is the people in your regular life and your regular peers don't really want to hear what you're going through, and you may not know how to socially interact with them. And then the people in camp are really your true peers because they just get it. And you can actually talk to them, right? You can. I recall a conversation. I work in a sleepaway camp also for kids with cancer, and like late night conversations about, well, my cancer's worse than yours, and my treatment was longer than yours.
Wow.
Like a regular child doesn't have those conversations.
Yes.
And it's almost cute. Like this is like they're fighting over who was sicker for longer and who had more stuff. But it's very impactful for them to learn how to interact socially with their peers. But it's also important for the siblings, right? The siblings who are isolated from the patients and the families. They don't think their siblings are so normal either. They think their siblings are spoiled rotten. They think they're getting all these prizes, and they're like, why am I not getting any of this?
Yeah.
And I was actually very fortunate to bring my kids with me to the sleepaway camp, and then also they came with me for a couple of days when I was at Sunrise. And I thought that it was eye-opening for me to watch my kids interact with the patients. So first of all, when they were really little, they're like, I don't understand. They're not sick. There's nothing wrong with them. Why are they getting prizes? I'm like, you know that she's bald and the other person only has one leg. They're like, yeah, but they're normal kids. Like, why did they get prizes and I don't get prizes? So putting the siblings into that environment where their patient or their sibling who is sick is now being normal helps normalize the whole experience for them. But it also teaches the siblings incredible social skills on how to interact with other people. So we were by the arts and crafts room because that was my favorite place in camp, in Sunrise. And there was a girl who was blind. And I was watching her do beading, which is pretty impressive. She was making a bracelet, and my daughter was sitting next to her and I was sitting across from her. And her hand was actually going beyond the beads. And I was like, do I tell her? Do I take her hand? And I'm thinking about it, right? I'm an adult. I should know what to do. And my daughter's sitting next to her and I watch her take her hand and just put it on the beads. And I was like, wow.
Yeah.
That is such a tremendous gift for her to just know what to do instinctively. And by having the siblings in the environment with the other patients and other campers, it just teaches them also how to interact and how to be accepting of other people's abilities or disabilities, and to see that they're what they're able to do, and to be able to help them grow in what they could do. And so I think it doesn't just impact on the child, it impacts on the entire family. And so when you're teaching the social skills for the patients who are missing out, you have to remember the kids are also missing out. The siblings don't get what they really need, unfortunately. And not because the parents don't want to, but they don't have enough hours in their days.
Absolutely. I want to just kind of take a quick step back, because a word that you keep saying is resilience. And it's something that we are also talking about a lot. And I want to talk to you about this concept of resilience, and just from your perspective, how camp builds resilience, and then also whether or not anecdotally you see resilience that they're building affect how they respond to their cancer treatments.
So, as an outsider, I'm not a camp director or the coordinator of activities. I look at camp as it's just a bunch of activities, right? It's so much fun. But I think that the staff at Sunrise spends an inordinate amount of time planning activities and planning interactions to build up confidence in the patients. Talent shows, activities, group activities, putting them even in the chill room, just to chill and have social activity. All of those things teach social skills, and those teach the kids winning and losing, right? So a normal baseball game, a normal basketball game, you don't have that when you're in the hospital. And the truth is, everybody gives you a prize, whether you deserve it or not. You get a lot of prizes. But in camp, it's real. You may be on the team that wins, and you may be on the team that loses. And I don't think I think you guys plan it as an activity that's going to teach winning and losing, but in a generation that doesn't know a lot about winning and losing, I think it's really impactful that it's okay to lose. It's okay to have a bad day, and it's okay to express your emotions. And it's okay to come to camp and be a little bit grumpy, right? And it's okay to come to camp and not want to participate in all the activities, and we'll help you find a different activity. And so it teaches the kids to express their emotions. It teaches them to build on the social skills and environment that they have from home, but in a way where it's not your mother saying, be nice, put your napkin on your lap and like wipe your mouth after you eat. It's you speaking with your peers. It's you learning from young adults or adolescents who are the counselors. And it just gives them more focus and makes them feel important. So I think they feel important in a different way when they're diagnosed, but maybe in a little bit of a negative way. And so I think when they're in camp and they're doing regular stuff and they're picked to do a part of a team or they're picked to do an activity, it teaches them regular social skills, but it builds a normal growth pattern for them. And, we don't want patients to just survive. We want them to thrive. We want them to be able to take their experience and to move forward with it and to learn how to roll with the punches. They've been handed, I kind of describe it as like a bomb going off in the middle of your family, and everyone's stuck on the floor like a little turtle on their back, and you have to help them up. You have to give them a hand. So we can give them a hand medically. Social work can give them a little bit of a hand socially, but childhood-wise, you give them that back, which is really, you give them childhood back, you give them family back, and you give everyone a little bit of hope in a lot of ways.
Yeah. That's very, very true. So I want to actually take this opportunity now to kind of pivot, and that you set me up kind of perfectly for this, to talk about the families, specifically the caregivers. We want to talk about what happens to the parents, and something that we're going to be talking about in a couple of weeks now, like about 2 weeks, is what happens when active treatment ends, specifically for the caregivers who have been just in this world of taking care of their child, and we're now closing the umbrella is what we're saying, and how that looks for the family.
Right. So Closing the Umbrella is a program that I started in memory of my mother. My mother passed away 3 years ago, and I felt very strongly from my own experience, and as well as seeing other families, that during treatment, we do have a lot of support. We have social workers, we have child life, the nurses are your best friend, and treatment's over, and we're like, okay, see you in 3 months. And they're like, wait, I don't have to come every week? I don't have to come twice a week? I don't, and it's almost interesting to watch the parents be like, oh, wait, I need to come. I need to come and see you, because they feel safe. They actually feel safe getting medication. They feel safe coming to this environment, because they know their child is okay and the child is being checked. And so when you send them out into the big scary world and you bring them back every 3 months for scans, there's a lot of what I call scanxiety, where it's just an emotional buildup of a bunch of nerves. But our team is focused on the patients who are on active therapy. And so the kid who now built all their resilience and power and stuff from Camp Sunrise goes back to school, and they're like, Mom, I'm done. I'm good. Don't bother me. But the parents are like, they just ran a marathon and they stopped cold turkey, and there's nobody there to help them. And it's not nobody, but it's really a very dramatic, like on off. And so we use closing the umbrella as you've weathered the storm. And then what do you do when you close the umbrella? And so the storm is over, and most of the parents have not had time to process what they've been through. They haven't had time to think about their experience. They haven't had time to think about their relationship with their child, right? The child lost their independence, but all they want when they're done with therapy is to be independent. Like, they don't want to talk to you. They don't want to, they could be like me and talk about it all the time, or they could be like someone else I know who actually has a very huge scar on his leg, and he's told everyone in his life that he was in a ski accident. So, and both of those are correct. Every person's entitled to their own response. But if your response as a child or young adult is different than your parents', then the parent really has nobody left to talk to. And so I found that these caregivers who gave everything to their children, unfortunately, there was nobody really there to help them. And it is completely normal for two parents to have very different reactions. So where I talk about my mother all the time when I was sick, and my mother was there, my mother, came to all my visits. She was always stayed with me in the hospital. She took me everywhere. My father, he parked the car. He drove us to the hospital. He stayed outside. He parked the car. And when he came in, 15, 20 minutes. And back in the days when meters needed quarters, he used to go and put a quarter in the meter. And then he'd come back an hour later and be like, okay, it's time for me to go. And I'm like, I don't get it. Like, my mother's here all the time and you're not here at all. In fact, when I was a resident, I was doing a rotation with one of the doctors who treated me, and I was engaged to be married, and he said, let me ask you a question. Is your father going to come to the wedding, or is he just going to sit outside? And I was like, wow. I really hope he's going to come. But the challenge as a child is I didn't understand. Many years later, as a parent, I understand it was too painful for him to watch me suffer. And besides not having camp or support staff, we didn't have any Zofran either. So there was a lot of vomiting going on. And there was pain. It was entertaining because my mother made a basin called My Faithful Friend that I walked everywhere with. And it wasn't painful to throw up. It was just nonstop. Yeah. So again, a parent watching their child suffer, for some parents, it's just impossible. Mm-hmm. They can't handle it. And so my parents had very, very different reactions, where my mother wanted to talk about it all the time. And like one of my sister-in-laws, like, why does it come up every single time we get together? It's been 40 years. And I'm like, well, it was kind of important. And my father doesn't like to talk about it at all. Like, really doesn't like to bring it up. Like, whenever I speak somewhere and I would send a copy of what I did for my parents, my mother would listen and my father would walk out of the room. So it's consistent. Like, the pain was too much for him. Yeah. And so I think, one, allowing parents or caregivers, because nowadays we have grandparents, family members, we have lots of different people who are involved, but any caregiver should be allowed to process in the way that they need to process. And, they should be told, and they should internalize, an abnormal reaction to an abnormal situation is normal.
Yeah, absolutely.
So even if they're not the type of person who walks out normally, but in this situation, it's not a normal situation. So any reaction is okay, but we have to help them process it, and we have to help them get through it. And during treatment, they're not really worried about that. They're not worried about themselves. There's not a lot of parents who are focused about themselves. They're all about their child. Yep. And when they're not about the child who's sick, they're about the siblings who are at home. So they really are amazing people who give so much to their children. And I thought that the Closing the Umbrella program would be an amazing tribute to my mother and everything she did for me, but would also be so vital to helping the parents of childhood cancer survivors thrive and move forward. Help them with their wellness, give them tools and techniques to process their grief, to give them some of our symposium is dedicated to education about interacting with your survivor, education about your own personal wellness, and just meeting other parents. So where the camp gives the kids opportunities to meet other kids, bringing the parents together and the caregivers helps them meet other caregivers who've been through the same thing. So you get that same, you don't get the competition of mine was worse than yours, but you do get that same of like, been there, done that, I can empathize with you. And empathy is what these parents need. And I think that that's what will help them process and grow and move forward. And so the question is, why Camp Sunrise? We did the first symposium here at Cohen's, and we had a decent turnout. But Camp Sunrise, because you have so many Sunrise families, and we wanted to partner with you to open up this program to other institutions and other families, and to grow the program, for this conference regionally, someday nationwide, and maybe even internationally with the footprint that Sunrise has all over the world and all of the patients that you impact. We want to help all of the caregivers get as much impact out of Camp Sunrise as the campers and their siblings. And so I always said there should be camps for adults. And so maybe one day we'll have a 1-week session for the caregivers. That'll be our plan for year 3.
Yeah.
But I think that part of it will be some social interaction, some activity, some way, even breathing, mindfulness, all of the things that who has time for when your child is sick. And now your child is better, your child is moving forward, you have a lot of anxiety. Whether you're an anxious person or not, it's normal to have anxiety. And whether you are back at work and thriving, anything can trigger, right? And the most fascinating thing for me is, even for me, when I tell my story as an adult of my experience as a child, I have to tell it the exact same way. I know what's really happening because now I'm a doctor and I understand, but I still tell it exactly the way that I remember it.
Yeah.
Which is good because a lot of it I remember as good stuff because my mom made it so wonderful. But I even remember sitting with my doctor. I remember him telling me everything that was going to happen. I remember where we were sitting, and he was talking to me. My parents were in the room, but he was talking to me. He told me that I had an ovarian tumor, that I had surgery, that the tumor came out, and now I would need chemotherapy. It would be last for a year, and then at the end of the year, I would have another surgery. And he made me feel like he was a partner in my healing, and that we would work together with my parents and God to make this all better. And I feel like when we take on being the physicians for these patients, we're taking on the whole family. And so Camp Sunrise gives us the ability to touch so many more families than just our own local institution. And so we hope that this program will grow and will help the parents grow and will help the interactions with their children, their spouses, as well as their friends and family, because it's a lifelong issue. Even if you survive, and even if you, which God willing, I just want to say that 85% of our children survive and go on to be long-term survivors, and there's over 400,000 childhood cancer survivors out there. So there's a lot of people that we could touch, and a lot of parents that we could touch with this program.
Absolutely. I mean, it sounds like an absolutely phenomenal program, and I'm just so happy that you're going to be bringing it to Sunrise and sharing it with our families. I will tell everybody listening, if you are interested in coming, or you know someone who might be interested, the Closing the Umbrella Symposium is going to be on Sunday, May 3rd at Long Island, at Sunrise Day Camp, Long Island, from 10 to 2. And we have a website for it, sunrisedaycamp-longisland.org/2026 symposium. I believe we'll be putting a link up somewhere with this podcast posting as well. So anybody who's interested in learning more or possibly attending can find out more there.
Right. And we partnered the symposium with a Sunrise Sunday so that the kids will attend the Sunrise Sunday, and the parents and the caregivers will be able to attend the symposium without having to worry about their children.
Absolutely.
So
it's going to be a great day.
We are really excited for this partnership and to continue enhancing the lives of cancer survivors, as well as increasing the footprint and impact of Sunrise.
Absolutely. Well, this has been an absolutely wonderful conversation. I've really just loved talking to you about all of this. It's been eye-opening, and to really address so many of the things that I know we at Sunrise have been experiencing and thinking about, and to have so many of them confirmed by you is just wonderful. So thank you so much for joining us today and for being a part of the Sunrise family and being a magic maker.
Oh, thank you.
All right, we will talk to you soon.